class. My name is Rachel Fabrizio. I'm going to be discussing the pulmonary system today, or the respiratory system today, also called the pulmonary system. I will be representing the healthcare provider of a pulmonologist or someone in pulmonary medicine, and you will be my audience introductory students. Before we get started, a pulmonologist studies the lungs, the airway, and the thoracic cage, anything to do with breathing, respiration, lack of breathing, diseases of the lungs, anything like that. So let's get started on our 10 medical terms. The first term we're going to talk about is anoxia, which is a total lack of oxygen in the body's cells. And that can happen because of no O2 in the air or the gases that are being breathed in, or an obstruction to the lungs or the airway. Our second term is similar, which is asphyxia, which broken down means a, without, and asphyxia, which translates to pulse. The term itself means an insufficient intake of oxygen, which can be caused by anything that disrupts the airway, toxic gases, choking, anything of that nature. Third, we have asthma, which is an inflammatory airway, and it makes it difficult to breathe. You have a lot of coughing and wheezing, and it gets worse with exercise or physical activity, anything that will increase your respiration rate. Fourth, we have atelectasis, which is a collapse of lung tissue, which prevents oxygen and CO2 from being exchanged in the lungs. This can be caused by pressure from a tumor or fluid or anything else that prevents the lung from expanding. Next is bronchitis, which is an inflammation of the bronchi in the lungs. It can be caused usually by either irritation or an infection. Number 6 is coryza, which is inflammation of the nasal passages and discharge, also known as the cold, and I think we all know what that's like. Emphysema, or chronic pulmonary obstructive disorder, COPD, is a condition which makes it difficult to breathe. It can be caused by smoking, and it makes the tissue in the small airway collapse when you exhale. According to the American Lung Association, COPD is preventable, and there are some steps you can take to prevent it. First, don't smoke. If you do smoke, try to quit smoking. Be very, very aware of secondhand smoke and how much you are smoking if you're a smoker. Smoking does cause COPD. Second, just be aware of air pollutants. Try to not breathe in dust and chemicals if you can help it. And they also suggest working with community projects to help protect and maintain clean air. Number 8 is hypoxia, which broken down is hypo, below, and oxia, which is oxygen. So you do not have enough oxygen in your system at that point. That can be caused by many things, but usually it's because you cannot breathe, or the gases that you're breathing are toxic and do not contain enough oxygen. Number 9 is pertussis, which is an infectious disease, also known as whooping cough, and it causes a terrible cough, especially in children and young toddlers. And an important note about pertussis and whooping cough. According to the CDC, the best way to prevent it is vaccination. For children under 7 years old, that's DTaP, and for adults, it's Tdap. Same thing, tetanus, diphtheria, and pertussis vaccinations. This vaccine is really important for parents, new parents of young children and new caregivers, and anyone who is going to be around young babies. And finally, we have SIDS, which is sudden infant death syndrome. This occurs when a baby stops breathing and therefore dies, usually because their airway is constricted or blocked. According to SIDS.org, there are some very important steps you can take to prevent your baby from SIDS. First, don't smoke while you're pregnant, and don't expose yourself to other secondhand smoke while you're pregnant. And be sure to keep your baby lying on his or her back, not on their side and not on their stomach. Keep your infant's crib as empty as possible. Place them in a sleep sack or maybe just one blanket that cannot wrap around their face or mouth. Now we are going to talk about some diagnostic procedures. The first is arterial blood gases, also known as ABGs. They take a sample of arterial blood and test for the amount of O2 and CO2 in the blood. Next are PFTs, or pulmonary function tests, and these measure the lung's ability to transport O2 and CO2. Next, we are going to discuss two surgical procedures and the difference between them. First is endotracheal intubation. That is when a tube is placed in the trachea through the nose or the mouth. It is used to help a patient breathe or sometimes to administer medication. Second, a tracheostomy is slightly different. A incision is placed in the trachea and a tube is placed there rather than going through the nose or throat. And lastly, we are going to go over some abbreviations. I wanted to keep this simple so that going forward there's absolutely no confusion about what these terms mean, because they are very important and they're also very simple, so there's no excuse not to know them. The first are CO2 and O2, and I'm sure most of you remember from chemistry or from high school science or anything like that if you haven't taken chemistry. Those are chemical formulas. So CO2 is carbon and oxygen with 2 parts, which is carbon dioxide. O2 is just 2 parts oxygen. And next is CPR. We all know what CPR does. Chest compressions to get the lungs working, oxygen back into the blood pumping, reaching the brain. CPR stands for cardiopulmonary resuscitation, which is pretty self-explanatory, as we have the cardiovascular system and the pulmonary system working together to resuscitate the patient. I know this is pretty simple, but I think it's really important that we have the basics understood. And like people say, there are no stupid questions, so I like to put these things out there in case anyone doesn't know. And that wraps up our discussion of the respiratory system. One final note that I was thinking about, being a person who used to smoke and quit smoking and used e-cigarettes and quit using e-cigarettes, I think that they are going to, there are probably going to be many studies coming out, since there have been so few, about the effects of e-cigarettes, and it is going to be a really interesting topic for medical students like us and you, and anyone in the pulmonary medicine field. So yeah, that's something to keep an eye on. Thank you for watching my video, and I hope you found it informative. Thanks.